Next up to speak to us this evening is Gwenda Burns. Gwenda is Chief Executive of Fertility Network, which is the UK's leading charity for people with fertility problems. I think many of you will have come across or heard her speak before or seen her at various events, but I will hand over to you now, Gwenda.
Thank you, Sarah. Does fertility treatment still need to be a medical secret? Fertility problems can be devastating, and treatment can be a long process to reach a final outcome. It takes a huge toll physically, emotionally, psychologically, for some financially, on relationships, and it is truly a roller coaster with highs full of hopes to the lows of disappointment. We support people every day, and each journey can be very different, but most, if not all, report tearfulness, depression, anger, the feeling of inadequacy, guilt and shame, loss of confidence, and being completely isolated. In 2016, we carried out a survey with Middlesex University, and some of the key findings showed 90% of respondents reported feeling depressed, 42% reported suicidal thoughts, 70% reported some detrimental effect on their relationship, and 75% would have liked to have counselling, but only 44% for various reasons did. Whether you are successful or your journey takes you on a different path, there is no magic switch to suddenly turn off all of these emotions and just put them behind you. The impact of fertility problems should not be underestimated. When everyone is trying to reach is successful and they're moving on to, for example, the antenatal clinic, following an extremely difficult and evasive journey, it seems wrong that midwives and consultants have no written medical notes of your fertility treatment. Some women will volunteer this information, and we as a charity encourage this. And through our education project in Scotland, supported by the Scottish Government, we encourage midwives to include mentioning the fertility journey, even fleetingly, in the initial consultation, which would allow a dialogue to open up if appropriate. If health professionals do not know what treatment you have had to reach this point, how can they offer proper medical care and support going forward when risks can be increased? For example, ectopic pregnancy, and you may need to have more monitoring and scans. The HFE statistics show there are more pregnancies than live births. In some cases, babies are born prematurely, which carry multiple risks. And anxiety and worry is heightened, usually with every twinge, worrying there is something wrong, calling their midwife constantly. And this is not easy for the midwife to understand, to be able to give appropriate support without the knowledge of why. So we conducted interviews with 5 mums who'd experienced the fertility journey. All 5 kept their fertility journey a secret. All were 35 and over when they gave birth. All had babies from ICSI or IVF in the last 5 years. 2 babies were delivered 6 weeks early. 3 out of 5 had non-elective C-sections. 5 out of 5 suffered a form of depression or anxiety. 4 felt under pressure to cope well and feared losing their baby daily. 3 went to their GP with symptoms of depression later than they should have. 2 suffered in silence, and 3 suffered postnatal illness after the birth. Now, of course, they were happy, they were pregnant, but as I said previously, the past emotions don't just disappear, there is no switch. All 5 said they had wished they had confided in their midwives. So we asked the question why they felt they couldn't. All answers were similar, so we used one. Saying nothing is easier than saying, I want to be normal like everyone else, but actually, my partner and I have just been on an emotional roller coaster to hell and back and have spent the last 5 years on it, trying to conceive, and now we're complete nervous wrecks, never believing that we would ever be parents, the opposite to everyone else. It can't be underestimated how difficult it is for someone to start the conversation about their fertility journey, and the fact it is a medical secret doesn't help. And let's not forget about the risks to those who are never successful. So this was a perspective from an unsuccessful patient who had came to the end of their journey. Final treatment pregnancy test was negative. They phoned the clinic to inform them of the result, and their worlds collapsed. They felt unsupported, isolated, a failure, and alone. Risks to mental health and well-being are hugely increased when unsuccessful and you're at the end of your treatment journey. Many people describe the feeling of being abandoned, having medical support from the clinic to having absolutely none. Some people's lives collapse, they can no longer maintain their employment, relationships break up, they isolate themselves, they feel and question where is their place in society. And in the worst cases, it can lead to suicide. Right through people's lives who have been unsuccessful, there will always continue to be trigger points. For example, Christmas is round the corner, completely geared to children, Mother's Day, Father's Day. So in conclusion, NHS notes are confidential. The fertility journey is, yes, very personal. However, success following treatment can result in physical risks being increased. Levels of anxiety and fear are multiplied. And if midwives and other healthcare professionals, including health visitors after a birth, do not know about the fertility struggles, then treatment, understanding and support can suffer. Just as when you have come to the end of your journey unsuccessfully, without the appropriate medical support, your mental health, well-being and physical health can be at risk. I totally believe our health professionals want to give patients the best medical care and support they can. But following fertility treatment, this can never truly happen as long as it remains a medical secret. Thank you.